Hello everybody. Today we will discuss a few of the endocrine diseases related to different endocrine organs. We will discuss diseases of the thyroid gland, some diseases of the pituitary gland, and the most important endocrine disease with many complications, which is so common, is the diabetes mellitus. First, we will start with the thyroid gland. Diseases of the thyroid gland are divided into two groups, those resulting in hyperthyroidism and those resulting in hypothyroidism. Hyperthyroidism also sometimes can be used interchangeably with thyrotoxicosis. Thyrotoxicosis is any state where thyroid hormones are very high in the blood. However, not necessarily the thyrotoxicosis is related to hyperfunction of the thyroid gland, because it can be due to administration of exogenous thyroid hormones اللي بياخدوا treatment of the thyroid hormone. بينما hyperthyroidism indicates hyperfunctioning gland. The hypothyroidism means decreased production of or decreased levels of thyroid hormones, and we have the euthyroid state, which is the normal levels of the thyroid hormones. So again, thyrotoxicosis is a hypermetabolic state. ليش بنسميه hypermetabolic؟ لأنه الثايرويد هرمونز يعتبروا metabolic hormones. فلما يكونوا الليفلز تبعونهم عاليين معناها احنا عندنا hypermetabolic state. Thyrotoxicosis is defined as elevated circulating levels of the T3 hormone and the T4 hormone, which are produced by the thyroid gland. Thyrotoxicosis can be divided into two groups, those that are associated with hyperthyroidism, that is thyroid hyperfunction, and those that are not associated with hyperthyroidism, like those that are associated with hyperfunction of the thyroid gland are also subdivided into primary, like a Graves' disease, we will talk about it, and a thyroid adenoma, which is a benign thyroid tumor. The second is called secondary. Here the cause is not primarily in the thyroid gland, it is due to a cause outside the thyroid gland, like in the pituitary gland. البيتويتري جلاند اللي هي الغدة النخامية هي اللي بتعمل الكنترول على معظم غدد الجسم بما فيهم الثايرويد gland. If we have a tumor in the pituitary producing the thyroid stimulating hormone, the TSH, this will result in increased thyroid hormone production by the thyroid gland. The other group, which is not associated with hyperthyroidism, like in cases of thyroiditis, where inflammation of the thyroid gland will lead to release of the stored hormones اللي بتكون مخزنة في thyroid glands early in the stages of the thyroiditis, but later on thyroiditis will result in hypothyroidism. والسبب الثاني اللي هو لما يكون في عنا exogenous administration of drugs containing thyroid hormones. فهون ما بيكون عندي hyperfunction of the thyroid gland ولكن عندي elevated levels in the serum of the thyroid hormones. The clinical manifestations and the symptoms of hyperthyroidism or thyrotoxicosis are the same. وسببهم هو الهرمونات العالية في البلد وزي ما حكينا these are metabolic hormones, so everything is rapid in the body. The constitutional symptoms are characterized by soft, warm, flushed skin because of the increased blood flow. زيد تدفق الدم للسكن. Heat intolerance. البيشنتس دائما مشوبين. And excessive sweating. These are very common symptoms. التعرق الزائد والشعور بالحرارة. Weight loss despite increased appetite. يعني بيخسروا وزنهم بالرغم إنه شهيتهم للأكل عالية. The gastrointestinal manifestations, there is rapid movement, rapid peristaltic movements or hypermotility في ال GI gastrointestinal tract. This will lead to diarrhea and malabsorption لأنه there is no time for the food or for nutrients to be absorbed. ثالث organ بيتأثر هو ال cardiac manifestations characterized by palpitations و tachycardia. ال heart rate بيكون عالي. neuromuscular abnormalities برضو ال patient بيكون nervous. But this is a very common manifestation for hyperthyroidism, nervousness and tremor اللي هو الرجفة باليدين و irritability وأحيانا muscle weakness ضعف في العضلات وبنسميها thyroid myopathy خاصة اللي proximal muscles بتكون affected فالبيشنت ممكن ما يقدرش يحمل أغراض for example. Ocular manifestations, this is a very important manifestation for the disease. A wide staring gaze كأنه المريض بيطلع بشكل staring and lid lag الجفن بيتأخر نزوله عن العين لما البيشنت يغمض عينه lid lag بنسميها. These are present because of the sympathetic overstimulation في تحفيز عالي من ال sympathetic nervous system للmuscles of the eye. و sometimes ممكن يصير في عنا برضو bulging of the eyes بنسميها exophthalmos بجحوظ في العينين. The true thyroid ophthalmopathy اللي هو associated with the exophthalmos وجحوظ العينين هذا with which we call it proptosis. This feature is only seen in Graves' disease. It's not seen in other forms of hyperthyroidism. بينما كل ال other manifestations may be seen in any disease leading to hyperthyroidism. This is the wide staring gaze which I told you about with some exophthalmos here which we call it proptosis جحوظ في العينين. These manifestations are typically seen in patients with Graves' disease. Now the other disease of the thyroid gland is called hypothyroidism. Hypo means the thyroid hormones are low, decreased concentration in the blood of thyroid hormones. The causes are variable, but worldwide the most common cause is deficiency of iodine. Iodine is needed in the thyroid hormone synthesis. Deficiency of iodine سواء due to malabsorption of iodine or to the nutritional deficiency will lead to hypothyroidism. In developed countries where iodine deficiency is not common because of good nutrition, the autoimmune Hashimoto thyroiditis is considered the most common cause. Another cause of hypothyroidism are genetic defects. This is rare, like thyroid dysgenesis or dyshormonogenetic goiter. Both of these diseases are genetic defects in the genes responsible for thyroid hormone synthesis, and they are rare. The clinical manifestations of hypothyroidism are characterized by slowing down of the metabolism. Everything in the body is slowed down. However, the manifestations differ according to the age group. In infancy or early childhood, the manifestations are characterized by a disease called cretinism, which is characterized by impaired development of the skeletal system and the bones بالإضافة إلى the central nervous system. For those patients رح يصير عندهم severe mental retardation. They are short statured and they have coarse facial features. The tongue is protruded outside of the mouth with umbilical hernia, فتق في السرة. Those manifestations can develop rapidly if the hypothyroidism is not treated. That's why nowadays any newborn within the first 2 weeks of delivery بعد الولادة they should be examined for the thyroid function. Because if we wait until more than 2 weeks and we discover that the patient is hypothyroidism, these manifestations are irreversible. They cannot, mental retardation راح يضل forever. So the screening thyroid function test for all the babies والnewborns أول ما ينولدوا is an important test وهلأ صار mandatory. كل الأطفال أول الولادة خلال أول أسبوعين لازم ينفحص لهم الثايرويد function و if it is hypothyroidism they should start on thyroid hormone treatment and thyroxine treatment which will prevent the mental retardation and the skeletal abnormalities. If it is not treated, these events can take place. So we call it cretinism in this age group. The other manifestation if happens when hypothyroidism occurs in older children and in adults, when the central nervous system development and the skeletal development has stopped. Here the manifestations are the opposite to the manifestations of hyperthyroidism. Everything here is slowed down. We call it, this complex of symptoms, we call it myxedema, which is characterized by generalized apathy and mental sluggishness، بحيث انه المريض لا يبدي اي تفاعل مع السراوندينج، و العمليات المنتل عنده بتكون كلياتها بطيئة، وات كان mimic depression. The other symptom is called intolerance، عكس الهيت intolerance. هون البيشنت بيكون حاسس دائما في البرد مش في الشوب. Obesity is a common manifestation، weight gain، بينما بالhyperthyroidism لاحظتوا انه في weight loss. الميكسيديما name إجا من ال deposition of a mucopolysaccharide rich edematous fluid in the skin and in the subcutaneous tissue and in a number of visceral sites like in the larynx for example. This accumulation of this fluid هو اللي أعطى المرض اسم الميكسيديما. Myxedema will result in broadening and coarsening of the facial features. معالم الوجه بتصير ضخمة. الtongue enlarged. الvoice is deep voice أو بيصير في عنا hoarseness of the voice. This is very common manifestation، وهذه اللي بتخلي المريض أحيانا ينتبه للhypothyroidism the change in the voice، وأحيانا بيسموه frog-like voice، بصير الصوت خشن و deep. البول motility is decreased على عكس الهايبرثايرويدزم، فهون بصير عندنا constipation مش diarrhea. Another disease that you have to know about regarding the thyroid gland is the Graves' disease. Graves' disease it's the most common cause of endogenous hyperthyroidism. فهنا it's hyperthyroidism. endogenous يعني مصنع داخل الجسم، مش نتيجة administration of drugs containing thyroxine. The Graves' disease is characterized by triad of manifestations. أول إشي Thyrotoxicosis caused by diffusely enlarged hyperfunctional thyroid gland in all cases. So there is no Graves' disease without thyrotoxicosis or without hyperthyroidism. This is mandatory for the diagnosis. The second part of the triad is infiltrative ophthalmopathy, which will result in proptosis وexophthalmos وجحوظ العينين، وهذا موجود في in 40% of patients, not in all patients. But this infiltrative ophthalmopathy is not seen in other forms of hyperthyroidism. It is only seen in Graves' disease. The third manifestation or the third part of the triad is localized infiltrative dermopathy، وهاي بنسميها pretibial myxedema. This is a myxedema that is different from myxedema of hypothyroidism. It's just localized to anterior part of the skin of the shins على lower limbs anterior to the tibia. فالسكن بتكون thickened نتيجة ال deposition of myxoid material. Graves' disease is an autoimmune disease. Again, it's more common in females. Female to male ratio is 7:1. It is characterized by elevated serum levels of T3 and T4 and decreased serum levels of the TSH, which is the thyroid stimulating hormone released from the pituitary gland. ليش بصير depressed or decreased؟ لأنه الغدة عم تفرز كميات كبيرة من التي 3 والتي 4، فالبيتويتري جلاند بتفهم هذا الموضوع إنه the thyroid should stop production، فبتبلش ما تفرز الثايرويد stimulating hormone in order to decrease the thyroid hormone production. But there will be no response by the thyroid gland because there is an autoimmune disease in it. So T3 and T4 are high, TSH is decreased. As I said, one of the causes of hypothyroidism in the developed countries where iodine levels are sufficient and there is no iodine deficiency is chronic lymphocytic thyroiditis, which we call it Hashimoto thyroiditis or مرض Hashimoto. There is a gradual thyroid failure due to autoimmune destruction of the thyroid gland. فالجسم بيكون antibodies against the antigens that are present in the thyroid gland. These antibodies بتروح وبتهاجم الغدة الدرقية وبالتالي بتعمل فيها damage. ففي البداية ممكن يصير في عنا release of the stored thyroid hormones فيصير عنا thyrotoxicosis أول مرحلة لمدة شهر for example. لكن later on البيشنت بيدخل بالstate of hypothyroidism. It is an autoimmune disease ومعظم autoimmune diseases are more common in women and it causes diffuse symmetric painless enlargement of the thyroid gland. So it is diffuse, all the gland is enlarged بشكل symmetric in the left and the right with associated hypothyroidism. And the last one of the thyroid disease that you have to know about is the multinodular goiter, which is very common manifestation of thyroid disease. Goiter is defined as any thyroid enlargement, so it's a clinical term. مصطلح سريري. Goiter does not differentiate between the causes of the thyroid enlargement. So Graves' disease can cause enlargement, goiterous enlargement. Hashimoto can cause goiterous enlargement, and the multinodular goiter can cause thyroid enlargement, but here we give it this name because of the multiple nodules. تضخم عقدي. Mostly caused by dietary iodine deficiency. Dietary iodine deficiency will lead to impairment of thyroid hormone synthesis, and this will lead to a compensatory rise in the serum levels of the thyroid stimulating hormone من pituitary gland, which understands that the thyroid is not functioning. فبيزيد the production of the thyroid stimulating hormone. This will lead to gross enlargement, compensatory enlargement of the thyroid gland in order to increase the production of the thyroid hormones عشان توصل البيشنت للإيوثايرويد state اللي هو النورمال thyroid hormone levels. فكل ما يقل الثايرويد هرمون synthesis بيرد يزيد ال TSH in order to reach the euthyroid state. The net result is goiterous multinodular enlargement of the thyroid gland. The causes in endemic areas with iodine deficiency is the cause. But in areas with iodine sufficiency, in which there is no iodine deficiency, we call it sporadic goiter. This is less common, and it's more seen in females with a peak in the puberty or young adult life. Now we move to the other glandular organ, which is the pituitary gland, الغدة النخامية اللي هي الغدة اللي بنسميها master of the body, which controls the glands of the whole body. The pituitary gland is divided into anterior pituitary and posterior pituitary. Every part is responsible for the production of certain hormones. Diseases of the pituitary gland includes hyperpituitarism, hypopituitarism, and local mass effect, which is the pituitary tumors. Hyperpituitarism is defined as overproduction of the pituitary hormones. The most common cause of hyperpituitarism is pituitary adenoma, which is a benign tumor involving the pituitary gland, the anterior lobe. Pituitary adenomas are classified according to the hormone they produce, and usually they are composed of a single cell type. Adenomas can be macroadenomas, in which the size is more than 1 centimeter, or microadenomas, in which the size is less than 1 centimeter. The first one of the adenomas is called prolactinoma. Prolactinoma is the most common type of hyperfunctioning adenomas. From their name, they produce the prolactin hormone, and hyperprolactinemia is the result, which can cause amenorrhea. Amenorrhea means cessation of the menstrual cycle. Galactorrhea, which means increased milk production from the breast, and loss of libido, which is loss of the sexual desire, in addition to infertility. The second type of adenoma, the second most common type of functioning pituitary adenoma, is called growth hormone producing adenomas with an excessive production of the growth hormone. The clinical manifestations depends on the age of the patient. If the patient is a kid, prepubertal, قبل مرحلة البلوغ. The disease that is caused is called gigantism. Gigantism is generalized increase in the body size أو مرض العملاقة with disproportionately long arms and long legs with a shorter trunk. In adults, the disease that is caused by growth hormone producing adenoma or by high levels of growth hormone is called acromegaly in adults after the closure of the epiphyseal plates. The symptoms of acromegaly is that growth is most conspicuous in the soft tissues, in the skin, in the visceral organs, not in the skeletal organs, because the epiphyseal plates are closed. Like their hands are very large, their tongues are enlarged, the jaw is large with protrusion of the tongue, separation of the teeth, so كل soft tissues are enlarged. Hands and feet are large with broad sausage-like fingers. Now we move to a very common and very important endocrine disorder, which is called diabetes mellitus or مرض السكري. Diabetes mellitus is defined as a complex of metabolic disturbances characterized by hyperglycemia. So الإشي الأساسي في الديابيتس هو وجود chronic long-standing hyperglycemia. The causes of diabetes are either defects in insulin secretion from the pancreas or due to insulin or defects in insulin action in the tissues or both of them. The chronic hyperglycemia والmetabolic deregulation اللي بصير في الديابيتس mellitus can cause damage to different organs including the kidneys, the eyes, the nerves, and the blood vessels. How to diagnose diabetes? Blood glucose levels are normally maintained in a very narrow range, usually between 70 to 120 milligrams per deciliter. The diagnosis of diabetes is established when the blood glucose levels are elevated, but it depends on which test we use. If we use a random blood glucose test, the cutoff point is 200 milligrams per deciliter, with the classical signs and symptoms of diabetes. When reading is not adequate, we should have more than one occasion of elevated blood glucose with the signs and symptoms of the disease. The second way of diagnosis is the fasting glucose over يعني تقريبا 12 hours fasting or fasting overnight before we do the test. The fasting glucose concentration of more than or equal to 126 milligram per deciliter on more than one occasion is diagnostic of diabetes. The third way is when we give the patient oral glucose. We call it an abnormal oral glucose tolerance test. The patient is given an amount of glucose to drink. Then we do the oral glucose tolerance test. We measure the glucose in the blood of the patient. If it is more than or equal to 200 milligrams per deciliter 2 hours after we give the patient the dose of glucose, this is diagnostic of diabetes. So إما الراندوم جلوكوز أكثر من 200 أو الفاستنج جلوكوز على أكثر من 1 occasion أكثر من 126 ملغ per deciliter أو we give the patient a glucose shot and we measure the blood glucose after 2 hours if it is more than 200. البيرسونز اللي عندهم السيرم فاستنج جلوكوز levels less than 110 ملغ per deciliter or less than 140 milligram per deciliter after an oral glucose tolerance test or on a random glucose test, these patients are considered euglycemic. Euglycemic, this is normal glucose level. فلازم يكون normally تحت ال 110 fasting. البيشنتس اللي بيكون الليفلز عندهم fasting between 110 and less than 126, those patients are called pre-diabetics. يعني they are at high risk for the development of diabetes in the coming period. These patients are called that they have an impaired glucose tolerance test. So if the fasting glucose بين ال 110 وال 126 هدول ال patients are called pre-diabetics وهم at risk for diabetes if they do not modify their lifestyle habits. How can we classify diabetes? Diabetes is classified as primary and secondary. Actually, the secondary diabetes cases, they account only for 5% of cases when there is a secondary cause or an obvious cause for diabetes or for hyperglycemia, like patients with the destructive lesions of the pancreas, like tumors, for example, or chronic pancreatitis. Patients with endocrine diseases like hyperthyroidism, like Cushing disease, diseases of the adrenal gland, diseases of the thyroid, for example. Patients بياخدوا drugs or medications that increases their glucose levels زي الcorticosteroids برضه. Genetic syndromes that result in hyperglycemia. All of these are considered secondary causes. For in these cases, we treat the cause, the underlying cause, and the diabetes will disappear. بينما primary diabetes when we have no obvious cause and it accounts for 95% of all cases, and those primary diabetes are subdivided into type 1 diabetes and type 2 diabetes. Type 1 diabetes we call it the insulin dependent diabetes, while type 2 diabetes we call it the non-insulin dependent diabetes. Type 1 diabetes, which also can be called insulin-dependent diabetes, accounts for only 10% of all cases of diabetes. So the majority of cases of diabetes are type 2. It is considered an autoimmune disease in which there is antibodies are directed or produced against the pancreatic beta cells, which are responsible for production of insulin. Damage to these B cells leads to deficiency of insulin, and insulin deficiency will lead to hyperglycemia. Now, سواء type 1 or type 2 diabetes, both of them they will lead to hyperglycemia, but there are differences between both of them and differences somehow in the management, and both of them can cause the long-term complications of diabetes. Type 1 diabetes most commonly develops in childhood and becomes manifest at puberty when most of the beta cells of the pancreas are destroyed. Most patients depend on exogenous insulin for survival, so insulin is needed for life. Without insulin, the patient will lose life and may die of the hyperglycemia. ما بقدر البيشنت with type 1 diabetes يعتمد على اللايف ستايل modifications والoral hypoglycemic agents لحالهم, because these patients have a state of insulin deficiency. There is no insulin production. So without insulin, they will enter into serious metabolic complications. The classical manifestations of the disease occurs, as I said, when most of the pancreas is destroyed, like 90% of the pancreatic mass. And this type is an autoimmune disease, and it is linked to genes involved in the immune regulation. بالعادة affects الصغار في العمر أو young patients، بعكس type 2 diabetes اللي بالعادة بصير elderly patients over the age of 50 and 60. But nowadays, because of the change in the lifestyles وانتشار الobesity, صار حتى type 2 diabetes can be diagnosed in young patients. Type 2 diabetes, the more common subtype, this disease is due to a combination of resistance to the insulin action by the peripheral tissues and inadequate response by the pancreas to produce insulin. So both of them will act together. It accounts for 80 to 90% of diabetes mellitus cases, and it is considered a multifactorial disease, which means there is no single underlying cause. It is a combination of multiple factors that could be environmental factors like the sedentary lifestyle and the dietary habits with obesity, بالإضافة ل genetic factors involving the inheritance of diabetogenic genes. These diabetogenic genes are so many genes, more than a dozen of genes, different loci on the on the genome and the DNA, they are associated with an increased risk for diabetes type 2. So there is no single gene. Like the genes in type 1 diabetes are different. They are called genes involved in immune regulation. So the pattern of inheritance is different. Type 2 diabetes is usually familial and tend to cluster in families. So genetic factors plays an important role, but if the patient genetically predisposed, when he controls the environmental factors, he can prevent the hyperglycemia from occurring. What is insulin resistance? Insulin resistance means failure of the target tissues to respond to insulin. So insulin is produced normally in the body خاصة في بداية الديزيز ولكن peripheral tissues ما بتستجيب للإنسولين فبالتالي there is decreased uptake of glucose بالمسلز فالجلوكوز بيضل في البلد وبيرتفع there is inability to suppress liver gluconeogenesis, so the liver continue to produce more glucose. If obesity and insulin resistance are highly connected because obese patients have a higher level of insulin resistance. That's why most patients with type 2 diabetes are obese at the start, but they start to lose weight later on with the disease. With the progression of the disease, even the pancreas will also develop some abnormalities and at the end even insulin production by the pancreas is also decreased. So we will have a combination of insulin resistance with decreased insulin production. Type 2 diabetes may manifest with polyuria اللي هي زيادة في المكتريشن زيادة الفريكونسي of urination. Polydipsia إنه المريض بيزيد الفريكونسي of drinking water and sometimes associated with polyphagia which is increase in the eating habits زيادة الأكل ويصاحبها weight loss. So polyphagia, polydipsia and polyuria are the characteristic triad for diabetes, even type 1 and type 2 diabetes. In obese patients older than 40 years of age, this is the typical age group for type 2 diabetes. Unfortunately, with the increase in the sedentary lifestyles in Western societies, type 2 diabetes is now being diagnosed even in children. So not all cases of childhood diabetes are type 1 diabetes, especially if the patient is obese. In some cases, medical attention is sought due to unexplained weakness. أحيانا المرض بيكون ما له أي أعراض بس عبارة عن تعب عام أو ضعف عام. And most frequently, the diagnosis is made after a routine blood or urine testing in asymptomatic person. About 1/3 of patients of diabetic patients have an elevated blood glucose levels while they are unaware of this. فهم بيكون اللي بنسميه silent diabetes بحيث انه المريض وهذا معظم الحالات هيك بتتشخص by a routine blood test. المريض ما بيعرف ما عنده أعراض ولكن عنده hyperglycemia. This table is very important in order to differentiate between type 1 diabetes and type 2 diabetes. Regarding the clinical manifestations, type 1 mostly occurs in childhood and in adolescence. Patients are usually normal in weight at the onset of the disease. They start to lose weight later on with the progressive decrease in insulin levels due to the damage in the pancreas, circulating islet autoantibodies. autoantibodies للبنكرياتيك بيتا cells أجسام مضادة و in the absence of insulin therapy البيشنت بيدخل بdiabetic ketoacidosis which is the acute manifestation or acute complication of type 1 diabetes. Genetic factors معظم الحالات are linked to genes involved in the immune regulation and there is an autoimmune damage in the pancreas with beta cell depletion. Type 2 diabetes, usually the onset is later in life. In adulthood, patients over the age of 40, vast majority of patients are obese, about 80%. There is increased blood insulin early in the disease, with later in life بيبلش يقل الانسولين level due to the ongoing damage in the pancreas secondary diabetes. There is no antibodies in the blood for the beta cells like in type 1, and there is no diabetic ketoacidosis. The genetic factors in type 2 diabetes are linked to diabetogenic genes and not to immune regulatory genes. والبيسك ميكانيزم في type 2 diabetes هو الانسولين resistance in the peripheral tissues، بعدين بصير associated معها decrease بالانسولين production later on. Long-term complications of diabetes occurs in type 1 and type 2 diabetes with uncontrolled hyperglycemia. So the basic mechanism for all of their chronic complications is hyperglycemia. The hyperglycemia affects multiple organ systems, including the blood vessels, the kidneys, the eye, and the nerves. We divide or subdivide the complications into macrovascular disease, which is mainly characterized by accelerated atherosclerosis. If you remember, حكينا diabetes is one of the risk factors for atherosclerosis. This atherosclerosis can lead to myocardial infarction if it affects the coronary arteries, which is the most common cause of death in patients with diabetes. Gangrene of the lower limbs if it affects the lower limb vessels وكان lead to diabetic foot وكان affect the renal arteries, renal atherosclerosis. Although the renal arteries are somehow protected against atherosclerosis, but in diabetes, especially at their ostia, at their bifurcation from the aorta. The other type of macrovascular disease is the hyaline arteriolosclerosis اللي كمان بنشوفه in patients with diabetes, which will lead to thickening of the arteriolar wall and narrowing in the lumen with decreased blood flow and ischemia. Second is diabetic microangiopathy. This affects the small blood vessels, not arteries, not arterioles. It's called microangiopathy. Leads to diffuse thickening of the basement membranes of all the capillaries in the skin, in the retina of the eye, in the renal glomeruli and renal tubules in the kidney, and even in the blood capillaries of the nerves. These diabetic capillaries بتصير more leaky than normal to plasma proteins, and this will lead to the معظم diseases associated with this microangiopathy due to these abnormal capillaries. This will lead to the development of nephropathy, retinopathy, and neuropathy. The ocular complications lead to visual impairment. This is one of the feared consequences of long-standing diabetes mellitus. The ocular involvement may take many forms like retinopathy, أكتر إشي بنخاف منه, cataract formation or glaucoma. glaucoma ارتفاع ضغط العين, وكاتاراكت اللي هي المية البيضاء باللغة العامية. Retinopathy, the most common pattern and the most feared complication. It is divided into non-proliferative retinopathy, which is characterized by hemorrhages in the retina, microaneurysms, dilatations of retinal capillaries with infarctions in the retina, while other form, which we call it proliferative type, in which new blood vessels will form in the retina and lead to fibrosis and can lead to blindness. Diabetic neuropathy, the most frequent is peripheral symmetric neuropathy. Symmetric means affecting both sides, left and right, of the lower extremities and upper extremities, affecting الموtor nerves والsensory nerves. خاصة الsensory nerves earlier than the motor nerves. فالبيشنت من ايش بيشكي؟ بيشكي من tingling sensation, numbness, خضران في الأطراف العلوية والسفلية وبيكون bilateral. This is typical for diabetes. And with time بصير في loss of sensation, loss of pain sensation وهذا أكتر شيء بنخاف منه عشان هيك هدول البيشنتس بصير عندهم ال diabetic foot. When they lose the sensation in their foot, for example, and يصير في زي any injury or any wound, البيشنت مش راح يحس بالوجع أو بالألم بهاي الووند وبالتالي راح الووند تكبر وممكن ما يكونش شايفها إذا كانت على ال plantar aspect of the foot, for example, and because of decrease in blood supply والإسكيميا ونقص التروية راح يصير عندي عاملين إضافيين وال increase susceptibility to infections فهدول البيشنتس عندهم أحيانا diabetic foot with ulcerations وممكن يحتاجوا أحيانا amputation. The other form of neuropathy is called autonomic neuropathy. The autonomic nerves are affected وهدول بصير عندهم disturbances في bowel movement والbladder function وبصير في عندهم incontinence أو سلس بولي أو سلس شرجي and impotence. In persons with a neuropathy, any infection زي ما حكينا in the toe may, for example, may be the first event in a long succession of complications leading to gangrene or bacteremia أحيانا and transmission of the infection to the lungs leading to pneumonia. Several studies have demonstrated that the morbidity and the mortality from diabetes both can be attenuated by the strict glycemic control. So the most important thing in diabetes سواء type 1 أو type 2 هو ال strict glycemic control. In type 1 diabetes, insulin replacement therapy is the mainstay of treatment. بينما in type 2 diabetes, patients may benefit from dietary restrictions and exercise. Both of these will lead to improvement in the insulin resistance. These are the first line of defense. وبعدين ممكن نستخدم oral hyperglycemic medications and very late in the disease they may need insulin replacement therapy. How can we assess the glycemic control? It can be assessed by measuring the percentage of glycosylated hemoglobin, hemoglobin A1C أو بالعامية السكر التراكمي, which is a measure of glycemic control over a long period of time, 2 to 3 months. This hemoglobin A1C is not affected by the day-to-day variations. يعني ما بصير أفحصه يوميا لأنه ما رح يعطيني أي تغيير بالlevel. It is measured every 2 to 3 months to see if the patient is under strict glycemic control or what. Hemoglobin A1C levels below 7% is considered as an evidence of a good tight glycemic control. Even we need to maintain a hemoglobin A1C below 6%. But كل ما كان الهيموغلوبين A1C levels قليلة البيشنت بيكون at increased risk for hypoglycemia. So patients with diabetes on insulin medications or on oral hypoglycemic drugs also they are under the risk of hypoglycemia, especially if they take their medications without taking their food. So good glycemic control will prevent or delay most of the long-term complications of diabetes.